So for my video, I am doing rubella in pregnancy. So what is rubella? Rubella is a contagious viral infection which is best known for its distinctive red rash. It's also known as the German measles. Rubella is spread by contact with an infected person. So this contact can be either droplet contact, so someone coughs or sneezes on you, or you have direct contact with an infected person. So rubella is not very dangerous for the average person. It just causes mild symptoms. But for someone who is pregnant, it is very dangerous because it can cause some severe damage to their unborn child. So the signs and symptoms of rubella is a mild fever with cold symptoms, a maculopapular rash that usually starts on the face and then it will spread to the rest of your body. So this is just a rash that has raised bumps and flat bumps. The glands at your ears and the back of your neck will become enlarged. You'll have a headache, and aching joints are usually common in young women who have rubella. So how does rubella affect pregnancy? So if you become infected with rubella while pregnant, the most damage will occur within the first 12 weeks of pregnancy in the first trimester. So exposure to rubella during pregnancy will cause congenital rubella syndrome, or CRS, and it can cause a lot of damage to the fetus. So mothers who contract rubella are at risk of stillbirth or miscarriage, as well as many birth defects, and the most common birth defects of CRS are deafness, cataracts, heart defects, intellectual disabilities, liver and spleen damage, low birth weight, and a skin rash at birth. So how do we test for rubella? When a woman becomes pregnant, she will automatically undergo routine screening for rubella immunity, and this is just to make sure she does not have rubella and she's not putting her fetus at risk. And this is done by a simple blood test, and it just detects antibodies that will provide immunity to rubella. And this is to ensure that, again, she has immunity to rubella and her fetus are both safe. So how do we prevent rubella? So a vaccine called MMR vaccine is given, and that stands for measles, mumps, and rubella. So that protects you against all three. And it's given first at 12 to 15 months of age, and then a booster is then given at ages 4 to 6 before the child starts school. And it's very important that girls receive all the vaccines for this because it will prevent rubella in future pregnancies that they may have. And children who are born whose mother have been vaccinated will have immunity for up to 8 months after birth, and this is just a passive immunity from the mom. And the vaccine can be given as early as 6 months if necessary. So if the child is going to be traveling to a place that still has active cases of rubella, it's important that they are protected against it, so they can get it as early as 6 months, but then they will also need to be revaccinated at the recommended later times. So it's important to teach your patients about rubella, and rubella is very rare in most countries because of the vaccines, but it's still active in some parts of the world, so just make sure to educate your patients to keep that in mind in case they are going to be traveling while they're pregnant. Some places like Africa and Southeast Asia still have cases of rubella. And it's also important that if you are a woman in childbearing years and you're planning to become pregnant, that you either have the MMR vaccine or you know that you are immune to it. Also, if you are pregnant, you cannot receive the MMR vaccine. So just to make sure to stay away from anyone that may come in contact with rubella, or stay away from places that have rubella if you are not immune.